Hey guys, welcome to EagleTalk, a mental health series for Cal State L.A. students. And we're here with Dr. Ramani Durvasula. Thank you so much for joining us.
Thanks for having me.
So Dr. Ramani Durvasula is a clinical psychologist as well as a professor here at Cal State L.A. So let's hear some more information about who she is and the many hats that she actually wears. Along with a private practice in Santa Monica, Dr. Ramani Durvasula brings her expertise on relationships, sexuality, health, and wellness on numerous major networks like Fox, Oxygen, Bravo, the History Channel, and Investigation Discovery. She's also a featured expert on Dr. Drew's Life Changers and The Today Show. Dr. Durvasula also has a regular column on the magazine Muses and Visionaries, entitled On the Couch with Dr. Ramani. Her publications include her most recent book, Should I Stay or Should I Go? Surviving a Relationship with a Narcissist, as well as her earlier work, You Are Why You Eat, Change Your Food Attitude, Change Your Life. We're going to be talking about all kinds of different mental health issues. So let's start with social anxiety disorder.
Yeah.
So what do you think differentiates someone who has social anxiety disorder versus someone who is just really a shy person?
Yeah, that's a great question because that's something where it can be a little bit gray in the middle. When we're looking at any disorder, including social anxiety disorder, we look at the amount of impairment it causes in their lives, in their work life, in their social life. Typically a person who's very shy, it's a style, but it doesn't tend to get in the way of their lives. People know about it, and they themselves are not experiencing significant anxiety about facing the world. It's just their style. A person with social anxiety disorder feels very anxious when faced in a situation where they think they'll be watched, observed, or evaluated, and they often are concerned that they will be evaluated badly. That tends not to be the case with a person who's shy. Unfortunately, I really do believe the world is very unkind to shy people, often misunderstanding them and sort of placing on them the sense of that they're cold or aloof or standoffish, which can make a shy person feel awkward. But ultimately we look at the level of impairment, and that's what often distinguishes the two.
So do you think that there's actually a stigma that is specific to social anxiety disorder?
I think with social anxiety disorder, I mean, the stigma is that, for example, not only are they often viewed as very shy, but they also may feel and present as being very socially awkward. So that can be a stigma because people might even label them unkindly as sort of weird or odd or something like that, because they can be very halting in a conversation because they're just simply not comfortable.
And do you think that someone's cultural context can actually influence their diagnosis?
That's such a great question about culture, because in some cultures people are definitely raised to be a little bit more quiet and private and hold back, and that can often vary even by gender. So as a result, whenever we sort of issue a diagnosis sort of as social anxiety disorder, we really want to pay attention to where they're coming from, how they were raised, what's their culture, even, for example, what is their language status. A person, for example, may not feel comfortable speaking English, and that might hold them back in terms of putting themselves out in a social situation, whether at work or at home or at school or whatever. Stress is a psychological experience. It's a perception. So for one person, a D on a test might be, oh, I should have studied more, and they go about their day.